Okay, so now I want to talk about posterior reversible encephalopathy syndrome, also abbreviated as PRES. Now, PRES is let's call it a autoregulation disorder that can be caused by a disruption of the blood-brain barrier, which causes vasogenic edema. Note that it's a vasogenic edema and not like in CVA, not like infarct that cause usually cystotoxic edema. Here is a vasogenic edema based on disruption of blood-brain barrier, based on disruption of autoregulation, usually or most commonly caused by acute hypertension. And now it usually affects the parietal area, the occipital area, the posterior part of the brain. Now, as you can see, the clinical presentation: headache, seizure, encephalopathy, visual disturbances, and usually marked hypertension. This is the main cause, which disrupt the blood-brain barrier and cause vasogenic edema, which can be seen on MRI as hyperintense lesion because it causes vasogenic edema. Now here you can see on T2 hypertense in affected regions. Usually DWI is normal, and hypointense in T1 with gadolinium, variable enhancement, MRA, vasculopathy with vessel irregularity. Treatment is supportive. Now it can be caused not just by hypertension but also by eclampsia, sepsis, autoimmune disorder, multi-drug chemotherapy, stem cell or solid organ transplantation. So it's not only hypertension, but most commonly it's secondary to acute hypertension. Now, if we look on imaging, you can see the intense lesion on the posterior part of the brain. Here you can see the hypoattenuating or hypodense lesions on CT. Here on MRI. Here on MRI again, you can see the posterior part are most commonly involved. On PRES, here again. So you can see that the posterior parts are most commonly involved. It can also affect the frontal area, but usually posterior parts, and this is a PRES, and you need to treat the underlying cause. Okay, so hyperintense lesions on T2 or flare on the posterior part of the brain. This is PRES, or if you want, posterior reversible encephalopathy syndrome, vasogenic edema, blood-brain barrier disruption, posterior part of the brain, secondary to many things, but mainly hypertension. Thank you very much, and that's it. Thanks for Radiopedia.